All right, let's talk about schizophrenia. Schizophrenia is a group of severe disorders characterized by disorganized and delusional thinking, disturbed perceptions, and inappropriate emotions and actions. Literally, schizophrenia means split mind, which refers to a split from reality rather than multiple personalities. The thinking of people with schizophrenia is marked by delusions. And these are false beliefs, often of persecution or grandeur. And sometimes they experience hallucinations. And these are sensory experiences without sensory stimulation. Hallucinations are usually auditory, and they often take the form of voices making insulting statements or giving orders. Word salad, again, is the idea or what schizophrenics will often do. It's just completely nonsensical talk. Words that shouldn't go together, they're putting them together. And it's a breakdown in selective attention, which we have talked about before. Again, disturbed perceptions, hallucinations. Auditory hallucinations means you're hearing voices, and sometimes they're saying insulting things or giving orders. Symptoms of schizophrenia right here: inappropriate emotions and actions. The flat effect, the flat effect is simply this just a catatonic state where emotions, where something should make you cry or make you happy or make you sad or make you angry, it's flat. There's no emotion there. Inappropriate actions, again, catatonia is when you're just sitting and staring, or you're pacing and doing excessive purposeless movement. And disruptive social behavior. Schizophrenia patients who are disorganized and deluded in their talk are prone to inappropriate laughter, tears, or rage, are said to have positive symptoms. And when appropriate behaviors are absent, for example, when the schizophrenia patient has a toneless voice, expressionless face, and a mute or rigid body, this person is showing negative symptoms. The subtypes of schizophrenia include paranoid, which is preoccupation with delusions or hallucinations, often of persecution or grandiosity. Disorganized, which is disorganized speech or behavior, flat or inappropriate emotion. Catatonic, which is immobility, extreme negativism, and or parrot-like repetition of another's speech or movements. Undifferentiated means many and varied. And residual, withdrawal after hallucinations and delusions have disappeared. Chronic or processed schizophrenia develops gradually, emerging from a long history of social inadequacy, and recovery is doubtful. Acute or reactive schizophrenia develops rapidly in response to particular life stresses, and recovery is much more likely. Onset of the disease, we've talked about that before. It does happen usually between the ages of 16 and 21. Researchers have linked certain forms of schizophrenia with brain abnormalities like increased receptors for the neurotransmitter dopamine. Impaired glutamate activity appears to be another source of schizophrenia symptoms. Modern brain scanning techniques indicate that people with chronic schizophrenia have abnormal activity in multiple brain areas. Out-of-sync neurons may disrupt the integrated functioning of neural networks. Some patients appear to have abnormally low brain activity in the frontal lobes or in large fluid-filled areas, and a corresponding shrinkage of cerebral tissue. Another smaller than normal area in persons with schizophrenia is the thalamus, and a possible cause of these abnormalities is a mid-pregnancy viral infection that impairs fetal brain development. For example, people are at increased risk of schizophrenia if, during the middle of their fetal development, their country experienced a flu epidemic. People born in densely populated areas where viral diseases spread readily also seem at a greater risk for schizophrenia. Nearly 1 in 100 odds of any person developing schizophrenia become about 1 in 10 if a family member has it, and close to 1 in 2 if an identical twin has the disorder. Adoption studies confirm the genetic contribution to schizophrenia. An adopted child's probability of developing the disorder is greater if the biological parents have schizophrenia. A complex disorder like schizophrenia is surely influenced by multiple genes with small effects, but identifying these genes has proven difficult. No environmental factors have been discovered that invariably produce schizophrenia in persons who are not related to a person with schizophrenia. However, researchers have pinpointed possible early warning signs of schizophrenia in children. These include a mother whose schizophrenia was severe and long-lasting, birth complications, Separation from parents, short attention span, and poor muscle coordination, disruptive or withdrawn behavior, emotional unpredictability, and poor peer relations, and solo play.